My name is Dipti Talaulikar. I'm a senior staff specialist in clinical and laboratory hematology at the Canberra Hospital and an associate professor at the Australian National University. I'm also a member of the Medical and Scientific Advisory Group of Myeloma Australia, and in that role, I've been asked to discuss the changing landscape of autologous stem cell transplant in multiple myeloma during the COVID-19 pandemic, specifically as the pandemic eases off. The specific questions that I'm going to address are why some centers are restarting their transplant programs and some patients are being encouraged to go through their transplants now, why in some situations that patients are still being advised to defer their transplant, and what might happen if we do have a second wave of COVID-19 infections in the future. When the COVID-19 pandemic hit us earlier this year, governments and healthcare organizations and medical teams had to change a lot of things to ensure that the COVID-19 rate of spread was managed, and also that healthcare organizations had the capacity to manage potential COVID-19 patients. Since patients with blood cancer were perceived to be at a higher risk both for contacting the virus and or dying from the virus, hematologists across the country worked very hard to ensure that we had ways and means of managing our blood cancer patients appropriately. As most of you know, newly diagnosed fit patients with multiple myeloma are usually given induction treatment for a few cycles, and this is then followed by high-dose chemotherapy and an autologous transplant, where the patient's stem cells that have been collected previously are reinfused back into the patient. Now, autologous transplant in particular is a high-risk procedure and requires the ability to manage patients in an appropriate setting, including inpatient care in a high dependency unit or even in ICU if that is required. When the COVID-19 pandemic hit, there was a major concern that the healthcare organizations, hospitals, ICUs, etc., would not have the capacity to manage patients, routine patients that were not infected with COVID-19. Imagine being in a situation where a patient has commenced a transplant, but then is not able to access the high-level care that is required because the hospitals are flooded with COVID-19 patients or medical teams are not available to manage routine patients. Therefore, a lot of transplant centers and transplant physicians took the decision to defer transplants in such patients. You might have been in a situation like that. The Medical and Scientific Advisory Group of Myeloma Australia therefore put in an application to the Pharmaceutical Benefits Advisory Committee to seek extra doses of bortezomib for patients who had to have their transplants deferred. This was supposed to be holding therapy so that there was no adverse outcome in patients who required delayed transplants. Now, however, as the peak of the COVID-19 pandemic seems to have passed and the Australian and New Zealand governments have managed very well to contain it, we are turning our minds again to optimal management of blood cancer patients. So it is really all about the risk-benefit ratio. Right now, the risk of contacting COVID-19 is relatively less, which is why we can turn our minds to the benefit from optimal management of multiple myeloma. Why is it safe to do so now? It's mainly because of the reduced risk of COVID-19 transmissions. Healthcare organizations, governments, medical care teams are now confident that they have the resources and the capacity to take a patient safely through transplant and manage their care appropriately should complications arise during this process. However, each site across Australia and New Zealand is different. So really you need to speak to your local hematologist, your treating physician, to decide when is the best time for you to have your transplant. When your physician takes a decision, it is usually based on a number of factors. They will take into consideration the rates of COVID-19 in your local community, whether there is any evidence of community transmission, what is the capacity of the healthcare system to reduce the spread of COVID-19, whether there is capacity to manage the complications that arise from transplant, and also what the regulations of the local healthcare setting and the government is. So there is a lot of thought that goes into whether you can have the transplant now or later. As we are moving forward and the government is easing a number of restrictions and opening borders, there is invariably going to be an increase in the number of COVID-19 cases. As the international borders open in the future, this will again increase the risk even further. So until there is a cure or a sure way of preventing the disease, hospitals and physicians will need to be mindful and agile about the way they manage patients with blood cancer, including myeloma. So you might find that the instruction to you from your physician or your hospital might keep changing as the situation evolves. However, I would like to reassure all patients out there that your healthcare teams, your physicians, your hospitals, and healthcare organizations have your well being right front and center, and that your care will be optimized irrespective of what happens with the COVID-19 pandemic leading into the future. Thank you.